So we're going to talk about living fully with metastatic breast cancer, strategies for coping, and we are talking about building a tool belt. It is very, very important that you have multiple strategies at the ready at any given time because, as you know, things change and they change quickly. And so what worked for you when you were coping in this phase of the trajectory may not work for you when you're coping with the next phase of the trajectory. And so things need to change as we go along. And so we're going to talk about really putting a lot of different tools in the tool belt that you can pull from at any time to experiment with and see what works for you at any given time. So what does it look like to cope well with metastatic breast cancer? We can't ignore it, obviously. It takes up space in your life. And at the beginning, when you're first diagnosed, it takes up a lot of space in your life. It takes up a tremendous amount of space in your life, where it's your every waking thought. It's the last thought before you go to sleep at night. And so as you move along in the trajectory and you begin to adapt, then it changes. You know, how much space it takes changes. So we are going to learn, you know, in this presentation, you are learning on your own in your own experiences, but you're going to learn in this presentation how to kind of move with it rather than move against it. So when we're moving against something, think about the energy of moving against something versus the energy of flowing with something. It's a very different energy. And if you can allow yourself to think about what that means to move with it rather than against it, you may find that you can move with a little bit more ease in various parts of the experience. If any of you know Dr. Don Dizon, Dr. Dizon is a friend of Living Beyond Breast Cancer and has spoken at this conference and many other things through this organization and lots of other organizations many times. He's one of my favorite people to listen to because he's lovely and he's smart and he's funny. And this is his quote: "Having breast cancer sucks. Having metastatic breast cancer sucks more." And I think it's really important actually to acknowledge and validate that this actually is really, really hard because, you know, one of the things I've heard a few times today, and I've heard many, many, many hundreds of times really over the course of my career, is the idea that the message that you will often hear is that you have to kind of keep a stiff upper lip, you have to stay positive, you have to, you know, you can't let yourself get too down or too anxious, and I just think that it's impossible. This is actually really hard, and the idea that you cannot have a response, an emotional response that's real to something that's actually really hard is absurd. It's absurd. And so I want you to just know that in your mind. You don't need to respond to people who tell you to stay positive even. You don't have to say anything about it. You need to know that it's impossible to just stay positive, that that's not a possibility. So I want to talk about worry, fear, and anxiety as normal human responses. This, you know, when people have worry or when they have anxiety, we worry about the worry, right? We worry about having a difficult emotion like that. And so what I hear from people is, I need to get rid of the anxiety. I need to get rid of it. I need to get rid of the worry. And we can't get rid of normal responses. These responses make sense. They are a response, a normal response to an actual threat, right? This is your own brain's emergency response system working properly when you have anxiety and worry and fear. It is a normal and it is a rational, not an irrational, it is a rational response to an actual threat. And so it's uncomfortable. I know it's uncomfortable. It doesn't feel good to have these emotions. But I don't want you to think that you're doing something wrong because you have them. You need to have them. What these emotions do is they put us on alert, right? They tell us there's something that we need to pay attention to. And that is very important because if we didn't have that emotional response, we might kind of move through this in a way that's not as urgent as it actually is. We need to respond. And so this puts us on alert so that we do respond. One of the problems with this is that we catastrophize. We have this kind of worst case scenario thinking. And so, you know, a lot of my patients talk about the catastrophic thinking, the worst case scenario thinking. Every time something changes, we go right to that, to worst case scenario thinking. That's actually fairly normal, to go to that kind of catastrophic thinking first, and then kind of work our way back from there. So even when you have that, and you're just all kind of a mess from having this worst case scenario thinking going on, and it's causing a ton of anxiety for you, even that I want you to see as a normal part of the process. It forces us to begin to reconcile with the information that we're getting. It forces us to work it through and doesn't allow us to ignore it. We can't ignore it. We don't want to ignore it. We shouldn't be ignoring it. One of the problems with your nervous system, however, is that the worst case scenario thinking is not based in fact, right? It's based in fear. And our brain doesn't really distinguish very well between what is a real threat and what is an imagined threat. And so even when we have the imagined threat, our central nervous system responds as though it's a real threat. That's the reason why I want you to have tools. I want you to have strategies to help calm your nervous system a little bit so that you can get to the point where you can start thinking more rationally, pulling away from the catastrophic thinking, and getting to the place where you can begin problem solving. Because when you're catastrophizing, you can't problem solve. And so we do want to move you away from that. And I want you to have your own tools to move yourself away from it. It's not necessary to see a psychologist or a social worker every single time you have a catastrophic thought, because you can have your own set of strategies that you can use for that. And that's what we're going to talk about today. So we're going to build a strategy for well-building, and for well-being. These 4 things are the 4 areas that we're going to talk about. A concept called putting the illness in its place, distinguishing what your areas of control actually are, managing and controlling the worry, and the acceptance of what is actually beyond your control. Because, let's be truthful, there are areas that are just outside of your control. We don't like that. We do not like that as human beings. We like to be in control. We can't be with everything. So what we want to do is figure out what we can control and control it, and then be able to distinguish what is outside of our control and be able to manage that. So putting the illness in its place, I really like this concept. I think it's a really important concept. And this, again, has to do with when you're first diagnosed, it takes up so much space in your mental world, in your psyche. You're thinking about it all the time. And for those of you who have been dealing with this for a long time, you will attest to the fact that pretty automatically, without a whole lot of specific effort, you can begin to kind of move it to the side a little bit during certain periods of time, maybe times of stability or times when things are a little bit more calm, or times when other parts of your life are demanding a lot of attention. And so we can begin to kind of move it to the periphery. That's kind of how I think about it. And there are ways that you can do that purposefully. Your mind will do that kind of automatically because we as human beings happen to be really, really good at adapting. We may not give ourselves credit for that, but it's true that we're very, very good at adapting to our circumstances, much more than you understand. I had a patient many years ago. It's one of the best examples of this that I've seen because it was so immediate. She said that when she had her biopsy, she had an earlier stage breast cancer, but when she had her biopsy, she was waiting for the phone call from her doctor, and when the call came, she said to the doctor, "If you tell me I have cancer, I am going to fall out of this chair." And the doctor said, "You do in fact have cancer." And she said, "I'm still sitting." So immediately, we move right into coping. What do I do? What do I have to do here? And so even though emotionally we're having an experience that's really uncomfortable, our brains are already adapting. They're adapting really quickly and really automatically. Our brains are built for that. And so it's an uncomfortable experience, but we're pretty good at it. So compartmentalizing is one of those ways. We need to put it in its place. This will always have a place in your life. It needs to. It will take up a certain amount of space. But we want it to take up less space on the day-to-day than it does on the day of diagnosis. And so we begin to compartmentalize and put the illness kind of in its place and recognize that it's a piece of the pie. It just can't be the whole pie. It is an aspect of your life, but it's not your whole life. And I heard I can't remember which presenter said this, that cancer does not define you. And I really agree with that. You are not cancer. You are Anne or Betsy or whoever you are. You are not cancer. You have an illness. You are not the illness. And so the Anne or Betsy that walked into the cancer experience is still there, whole and intact. That person, with all of his or her idiosyncrasies, strengths and weaknesses, personality quirks, you're still there. You're just holding something that's really heavy and difficult. So the image that I like to use is moving cancer to the periphery, to your peripheral vision. It starts here. You want to move it over here. It's here. You can see it. It's in your peripheral vision. You know, you're aware of it. But you want to move it out of your field of vision so that it's over here and it's not interfering with every aspect of your life. Journaling, by the way, I like this picture because I like journaling. Journaling is one way of moving that cancer to the periphery a little bit. Using writing is very interesting to me because it engages a part of your brain that allows you to use more problem solving. If you're just thinking about something or just thinking about it and talking about it, when you're thinking about it, talking about it, and writing about it, you're using more of your brain to process it. And so it just allows you another avenue to help process your experience. So distinguishing your areas of control, what is actually within your control. There's a lot of younger people in the room. Every time I come to this conference, it's something that kind of stands out, that there's a lot of younger people who are diagnosed metastatic. And for the younger person, it's very much an off-life cycle event. And that can be extremely isolating. I think that having metastatic breast cancer is isolating in and of itself because it is the minority of people who have ever been diagnosed with breast cancer. But having metastatic breast cancer as a young person is more isolating. And so it's hard to have control of something when you feel like you're the only one in the room who is managing this problem. However, you are sitting in a room full of people who get it, and so when you're utilizing a community of people through organizations like this, through support groups, through advocacy groups, then you are fighting off the isolation. And I strongly, strongly encourage people to get as involved as they need to be or want to be. You don't have to be involved in order to be well. But for some people, having that involvement and having that village, your peeps, having that is really helpful. I ran a support group for a long time for women with metastatic breast cancer. There's a couple of people in this room who are members of that group. It was incredibly powerful how those women supported each other, how important that was to their well-being. So when that's available to you in any way that it's available to you, and the truth is it's available to everybody in some form or another, I encourage you to explore it to see if it's helpful for you. You will also have the experience where you have some friends who will distance themselves from you, because I see some people nodding. It's a tough one. That is a tough experience because you would think that when you have something really difficult going on in your life, your friends would just rally around, and put their arms around you. And I think that the reality is that for some people, it is too much. They don't know how to respond. They don't know what to say. They don't know how to support you. And so what they wind up doing is disappearing. It's very hurtful. It can be very hurtful. And I want you to see that. I just want you to reframe that a little bit as a weeding out process. Because over the course of a lifetime, the truth is we have friends that come and go all the time. People who just come in and out of our lives. We have a few solid ones that are there forever, you know, but there are always going to be the people who come in and out of our lives. I think that sometimes the people who disappear, it's surprising, and you would think that, okay, that's the person who's going to be there for me, and they're not. But then there's always going to be somebody who surprises you in the other direction, somebody who surprises you by being there for you in a way that you did not expect. And so that helps to balance the scales a little bit, and I really just want you attending to the kind of dynamic of that, and that these are just human beings, and they're doing what they need to do for whatever their reasons are. And I've talked to many patients about forgiving, just forgiving it, and focusing your attention on those people who are there for you, those people who are supporting you in a way that is substantial and loving and caring. It's like the milk of human kindness. There is nothing like it. And I'm not even talking about like your family members or your spouse. I'm talking about your girlfriends, your friends. You know, that's good stuff right there when they are there for you. And I want you to draw every ounce of that milk of human kindness out of it that you possibly can, and release what's been maybe disappointing or hurtful for you. Take control where you can. So these are just areas, there's 9 here, there's probably many more, of areas where you can take control. So we're going to talk about some of these very specifically, but I just want you to take a look at, you know, cleaning up your nutrition. It doesn't have to be perfect, but I'd encourage you to clean it up. Exercise we're going to talk about in a minute. Medical appointments, those are areas where, that's an area where you can take greater control. And I've listened to these physicians speak tonight or today, and they have, every one of them said, talk to your doctor, be honest with your doctor, tell your doctor what's going on, be straightforward, don't be afraid to talk about something. Listen to that. Don't hold back. This is not a time to hold back because you think maybe your doctor is not interested or doesn't have enough time. Bring it up. And write a list before you go to your doctor's appointment. Write a list of all the things you want to bring up, and then check it off as you go. And if you run out of time, you hold those questions for the next time, or you ask the doctor, how can I get in touch with you? I have a couple more questions. But take control of those appointments. They are yours. They do not belong to the doctor. They belong to you. So take control of those appointments where you can. Let your doctors know what you need. Your social relationships, we just talked a little bit about this, taking control of those social relationships, letting your people know what you need. When people offer to help, say yes. They want to help, and you may need the help. And so it's actually a mutually beneficial dynamic when you say yes, when somebody offers their help. They feel good about helping you, and you get something that you may need. And so if you can give some specific request, I need help with childcare, I need help with walking my dog, I need help with a couple of meals, whatever it may be, when you can give that specific request, that's really helpful to those people who are offering their help. Say yes to those. Your family relationships, same thing. Let people know what you need. Faith and spirituality, these are actually, it is really helpful for a person who is spiritual or faithful to lean in even more to that area of comfort. That's actually very, very psychologically beneficial for people. And if you are having a struggle with your faith or your spirituality because of what you're going through, I really encourage you to talk about it, read about it, talk to friends about it, talk to clergy about it, talk about that struggle, because you want to utilize every area of help and support that's available to you. And so don't run away from that struggle if that's what you're struggling with. I'd like to see people lean into that a little bit. Your work life, again, this is complicated because, how much you say or don't say in your work life is very complicated depending on your situation. But again, it's something that I want you to actively think about rather than avoid. Sleep. I cannot say enough about the importance of sleep. And people are challenged with this because you're busy, or because you're not a good sleeper to begin with, or lots of different reasons. And so the thing that we wind up sacrificing is sleep. Sleep is so critically important to your overall health and to your psychological health, and it cannot be the thing that is sacrificed first. You've got to get rid of that idea that you don't have time to sleep. You must have time for a good night's sleep, for solid, restorative sleep. And if you are really having trouble sleeping, then you need to speak with your medical oncologist or palliative care doctor about that so that you can find ways of getting better sleep. Our cells repair themselves during sleep. We need the sleep. Emotional and psychological support, we're going to talk about that a little bit more in a minute. So I don't want to rush through this particular topic, exercise. I feel very strongly about this, and anybody who's ever been a patient of mine or been in any one of my support groups knows how I feel about this, because I talk about this with everybody. This is one of those things that is available to you, to all of you, in some form or another. And if you are not exercising, you are not doing everything you can for yourself, to help yourself both physically and psychologically. There are so many psychological benefits to exercise, it's hard to even list them. I see exercise in many ways as the magic pill. I'm going to go back for 1 second to something that I wanted to say at the very beginning. I've worked with hundreds of metastatic breast cancer patients over the years, and what the metastatic population says to me almost unanimously is that they can handle the physical pain, they can handle the treatment side effects, they can handle surgeries, they can handle all of that, but the psychological stuff is the hardest part, because we are not given the help that we need for managing the psychological consequences of something that is so challenging. And it is just so critically important to acknowledge that we have to address these psychological issues in order for us to be well. We can't be well if we're taking care of ourselves physically, we're participating in our treatments, but we are not addressing the psychological piece, because the psychological piece is associated with suffering more than the physical piece is. We're pretty tough. We can handle physical pain, especially we're in treatment, we know it's going to change, but the psychological, I got to deal with this for the rest of my life. That's really hard, and that's very closely associated with suffering. And so this whole presentation really is about reducing your suffering. There's a great saying that pain is required in life, but suffering is optional. So this is about reducing that suffering. Exercise is a way of reducing suffering, because when you are physically active, you are releasing all kinds of good neurotransmitters in your brain. The feel-good neurotransmitters get released. You are releasing cortisol, which is the stress hormone that is produced by our adrenal glands. Cortisol is actually found in sweat. And so when you sweat it out in a workout, you are physically releasing cortisol. You're getting rid of it. You're pushing it out of your system. And this is one of my favorite pieces of information. Sweat, urination, and tears are the 3 primary ways of releasing cortisol from our system. So working out drinking more water, and having a good, solid, ugly cry. I mean, don't you feel better after you've had a good cry, right? So it's real. I mean, the mind-body connection is real. We're not making this stuff up. So when you are exercising, you feel like you're doing something good for yourself that helps you to feel better and it helps to motivate you. You improve your sleep when you exercise. It's certainly good our bodies are not meant to be sedentary. Our bodies are meant to be active. And so when we allow our bodies to be active, even in the most minimal way, I mean, clearly some of you are going to have limitations with what you can do physically, and that's absolutely fine. But figure out what you can do. Chair yoga. You can do chair exercises. You can do chair weightlifting. You can just simply go for a walk, a short little walk, and build that to something bigger over time. There will be times where you have to change it, again, going with the flow, depending on how you're doing and what's happening for you. But figure out how you can exercise, because it is so important to your mental health to exercise. I woke up this morning with a headache, and I knew that if I work out, my headache will go away. The last thing I want to do when I have a headache is work out, right? What I want to do is go back to bed. But I knew that if I got on my bike and did my thing and sweated a little bit, that the headache would go away, and of course it did. So it cannot be, you can't see it as optional. You have to see it as mandatory. Moving your body should be mandatory. One of the things that anxiety makes us do is freeze. It makes us stop and kind of cocoon ourselves. Don't let that happen in terms of moving your body. You're going to feel better about yourself if you exercise. Did I make my point clear? I named my dog 5 miles so I can tell people I walk 5 miles every day. Whatever it takes. All right, another area of taking control. Here's my meditating dog. I kind of like dogs, so. By the way, having a dog is really good for getting you out and moving, so. So there's a picture of meditating dog. I can't help myself. So meditation, prayer, breathing exercises, these are areas, again, this is about taking control where you can. Meditation is very intimidating for people who have not meditated. They just see it as like, oh, I'm not doing that. That's a little weird. I can't sit in the lotus position. I'm not doing it. Meditation can be a lot of different things. Prayer is meditation. Repetitive thoughts are meditation. Counting can be meditation. Just simply counting, letting yourself quiet down and count. The most simple way of meditating, walking meditations, anything that you can do to kind of quiet your mind. Because you know that when you start going, when that train starts moving with those uncontrollable thoughts, you're off to the races, you're in trouble. And so you need to have a strategy for quieting that down, for quieting your nervous system down. And so meditation is a great one for that. Breathing exercises are really good for that. I really encourage people, I don't have time to do it today, but look up some breathing exercises. They are very simple. They are easy to do. They take a little bit of effort because you have to learn how to do it and then practice it and get good at it. But boy, I mean, it is just one of those things that you can have in your pocket all the time. Think about when you are about to go in for a scan, or when you're sitting in a waiting room waiting for a doctor's appointment, or you're waiting for results of a scan. Think about how calming your nervous system would help you in that moment. Because I know that the catastrophic thoughts are churning in those moments, that you're off to the races when that's happening. And so when you have a strategy, something in the tool belt that you can easily pull out and use. I use this all the time. You can do it driving, you can do it in traffic, you can do it in a waiting room. Nobody needs to know you're doing it. So learn some breathing exercises, learn some simple meditation practices that you can use during the most difficult times. Psychotherapy and support groups. Obviously, I'm a little biased here. You know, I spent my career as a psychologist. I did psychotherapy, individual and family and couples psychotherapy for people with cancer and their families for many, many years. I know it helps. So, you know, it just does. And the barrier is more about finding a therapist, finding the right therapist. I think that's the biggest barrier, truthfully. I think that most people these days feel pretty good about, yeah, I could probably use some therapy. We kind of finally think differently about therapy than we used to. But it's worth doing the work, the legwork, to find the right therapist. Start with your medical team. Start with asking your medical oncologist, your nurse navigator, your other allied professionals, your palliative care doctor. Start there by asking them. There are so many services available that are either free or covered by your insurance. I know the cost can be prohibitive sometimes as well. But again, keep working on it to find, whether it's individual therapy or group support or whatever it might be. And when I say group support, there are support groups that are through like Facebook or whatever, and that's not what I'm talking about necessarily, although I think that that can also be helpful. But when you're in a formal support group that's smaller, and you're really interacting and getting to know the people in that group, it is a powerful experience. And so I strongly encourage you to decrease the isolation by having somebody that you can talk to about this in a really honest and forthcoming way, and somebody who knows their way around cancer. So you want to look for somebody who specializes in psycho-oncology, or somebody who is a health psychologist or a therapist that specializes in health psychology, because those people know their way around illness and disease. And it's just a different thing than, you know, what most psychologists are trained to do. Meditation, do the best you can. Today, I will live in the moment, unless that moment is unpleasant, in which case I will eat a cookie. Whatever it takes. So again, I want you learning breathing exercises. Look them up. If you're writing things down, or if you have a phone, and I know you all do, I want you to write this down. I want you to write down 4-7-8 breathing. 4-7-8. Look it up. And I want you to look up squared breathing. They're just 2 breathing exercises that are simple and effective. And what they do, when you engage in these breathing exercises, they literally turn on the rest and relax response of your central nervous system. So it's not just like, you know, breathe through it, that's all loosey-goosey and crunchy granola. It's not. Really what it is it's very biologic, where your nervous system has a fight and flight response, and it has a rest and relax response. And when you're panicked, you're in fight and flight, right? You have a way now with breathing exercises of turning on the rest and relax response. It will calm your system down. And when your system calms itself down, you can get to more rational thought. You can't get there when you're in fight and flight. So this slide really is about, you do not need to be perfect with any of these things. Meditation doesn't need to be perfect. You don't have to meditate for an hour a day in the lotus position. Do the best you can. You don't have to do yoga every day. Do the best you can. You don't have to exercise every day. Do the best you can to move. All of it is about improving, not being perfect. There's too much. It's too much. You know, I think about this with nutrition. You know, all the things we hear about sugar and soy and alcohol and all of these things, you know, you don't have to be perfect. Make your own decisions about where your focus is going to be and what's actually important to you. You don't have to do it all perfectly. There's no such thing. Okay. Managing the control and the worry. So one of the things that is really important in terms of managing control is triggers. So we are triggered by certain things, and I just listed a few things here that are typical triggers for people. Scans, the month of October, Breast Cancer Awareness Month, and everybody's wearing pink, right? It's just very triggering for people with metastatic breast cancer. Family gatherings, doctor's appointments, these are just typical things that can trigger a difficult emotional response. So what's important here is to know what your triggers are. I want you to specifically identify what are the things that are most triggering for you so that you can prepare adequately for those particular things. So when, I've talked to a lot of people who are very uncomfortable when they run into somebody, like in the grocery store, who says, hey, I heard you got breast cancer. Hey, I heard you're not doing so well. Or some comment like that. I want you to have, if that's triggering for you, running into somebody and you're not going out because of it, I want you to have a script. I want you to know what you're going to say in situations like that. I want you to know what you're going to say at family gatherings when people ask you how you're doing, or when people tell you to stay positive, or keep your chin up, or hey, are you done with that breast cancer thing yet? You're done with your treatment now? Know what you're going to say. Have a script, literally memorize it, so that you feel prepared going into the situation. When you feel prepared, that's an anxiety buster. That's going to decrease your overall level of anxiety. So identify what your triggers are, and then have a strategy for those triggers. Medical appointments is a perfect one. We just talked about using breathing exercises to help you when you're sitting in the waiting room waiting to go in for your scan, or when you're waiting for your results. Those are just such common triggers for people, and they kind of lose their ability to think rationally in that moment. Know what you're going to do. The other thing about worry and controlling the worry is I want you really investing your time and your energy into the things that bring you joy, into the areas of your life that are actually comforting for you, that help you, no matter what those things are. Who are the people who make you feel safe and make you feel secure and loved and comforted and embraced? Who are those people? I want you to specifically intend to spend more time there, spend more time with those people. Nature, I have this picture of walking in nature. For me, that's kind of my thing. I like to be outside and in nature, and it just helps to calm me down. So figure out where those things are, who those people are, what those circumstances are that help you, and then intentionally spend more time there. You are in control of where you put your energy and your time. So put it in the places that help you. That decreases the suffering. That's the whole goal. There's enough suffering that's going to happen no matter what you do. So in those places where you can decrease your suffering, please do it. Please do it. Do it for you. You're worth it. You're worth it. If that means that there are other people in your life who get a little bit less of you, okay. They'll be okay. They really will be. Find the humor. Do you mean to tell me that a stress ball isn't for throwing at people who stress you out? When I used to run that support group, it was run in the waiting room of a surgeon's office. And I would have people kind of looking around the corner at what was going on out there because we were laughing, right? Looking at Lynn over here, who's right. We would be in hysterics sometimes because it was sometimes a little bit morbid humor, and sometimes it was just humor. There was something funny going on, somebody's story that we all kind of appreciated and found humor in. Find humor. Specifically set out to find humor. There are times where I'll say, go watch a funny movie. Like, get a good belly laugh going. It's good for you. It releases all those good feel-good hormones and neurotransmitters. Do what's good for you. Do what gives you relief. Do what decreases your suffering, even if it's just for a moment. Is that a cure? No. Does it help in the moment? Yeah, it does. This is about living with something, right? It's not about fixing it. There is no fixing it. It's not about getting rid of it. There is no getting rid of it. There is no getting rid of the anxiety. It's about managing it. And if you can manage it better because you're engaging in some of these strategies, this is not about denial or avoidance. It's really about incorporating all of the tools that are available to you so that you feel like you're doing this well, you're doing this better. You're handling this because you are perfectly capable of handling this. There are moments that you're in a puddle, but those are only moments. You don't stay in the puddle. So what about when it really gets tough? What do you do when something happens, when there's a change, when there's something scary going on, and it really gets tough? Because all of you have had that experience, and you will continue to have those experiences. We first have to just let ourselves stop and breathe. Because what we do is we hold our breath. And so I want you to consciously, again, go to that breathing exercise and start to just breathe. You're going to breathe through it. You have to accept that when you find out some bad news, when you find out about a progression, or you find whatever it is that you find out that's upsetting for you, that it's going to lead to that catastrophic thinking that we were talking about earlier. And so what I want you to understand is that you're going to get this news, you're going to first hold your breath, and then immediately the catastrophic thoughts are going to start happening. Oh my God, that's it, it's all over, I'm going to be dead, I'm going to be dead in 2 days or in 2 weeks. I'm going to suffer, I'm going to be in pain, I'm going to lose everything I've been working for. So that catastrophic thinking is a first response, and it's a normal response. And so I want you to accept that. I want you to recognize that this is actually normal. I can expect these things. But then what I also know is normal is that that's not going to stay there. What's going to happen is I'm going to begin to incorporate the information. I'm going to begin to process what's going on, what's actually going on. I'm going to be talking with my doctors or my team or whoever it is, my family, and we're going to begin to figure it out. You've already done this. You've already done this. You're experts at it already, because you've already had this experience when you were first diagnosed. You had exactly that progression of experiences, and then you learn to adapt. We are very adaptable as human beings. Getting the facts. Obviously, facts are stress busters, and so the more information that you get, the better. The more factual information you get, the better. It's hard to catastrophize when we're dealing with facts rather than fantasy. And again, our brain doesn't know the difference between the fantasy and the reality. And so we have to force ourselves into the reality, into the factual information. This disease forces you to live with a certain amount of uncertainty in your life. You have always lived with uncertainty, by the way. You know, we're just so much more aware of it when we have a disease like this. You're so much more aware of it. There's a ton of uncertainty. So you don't know what tomorrow is going to bring. And so that's about acceptance, accepting the uncertainty, and that you actually do know how to cope with it because you have coped with it. You have. There's a concept called post-traumatic growth. Most of you have heard of post-traumatic stress. There's also post-traumatic growth. Post-traumatic growth is very interesting to me because it really is the idea that we grow from difficulty, we grow from challenge. And the people who have written a lot about post-traumatic growth use the term seismic challenge, like something that shifts your life, shifts your world, shifts your perspective, and a metastatic breast cancer diagnosis qualifies. And so through that difficulty, we have the opportunity to grow and change. Remember that we don't grow when things are fine, right? We don't grow when everything is fine. We grow when things are not fine. When we are pushed outside of what is been normal for us, that's when growth is actually available to us. And so I want you to just understand that this experience, you've already grown from it, you've already changed, and you can intentionally grow and change from it. This is not about whitewashing the experience. This is really about understanding that there are opportunities to improve your relationships, that there are opportunities to improve maybe your faith or your spirituality, opportunities to forge new directions in your life, to forge new relationships, to meet new people. Here we are, talking to each other, sitting at tables with strangers that you've never seen or spoken to before. So the opportunity for growth, how about all of the people who are advocates? You weren't advocates before this came into your life. You weren't going to Washington, D.C. and talking to your congressmen and your senators, but you are now. That's growth. That's post-traumatic growth. So through trauma, we have an opportunity. It kind of cracks us open and allows new space for new experiences. Future planning, I'm going to talk about this just very quickly. This is actually, nobody wants to talk about this, but actually letting yourself talk about this and handle some of these things is a stress reducer, because it's something that we worry about. And I think that if you just sit down with your family, your attorneys, and just kind of go through some of these things so that you have a will, you have funeral plans, you have your wishes known, you have advanced care directives, have those things. It actually helps to just put it aside, and then you don't have to worry about it anymore. So, and when anxiety or fear actually just does get the better of you when you are in the puddle on the floor, you have to just let yourself go through it. You have to just let yourself be in a puddle for a little while and not judge it. It's okay. You're not going to stay in the puddle. But it's okay to have to go there. It's scary. It's hard. It's really hard. And so to let yourself be in it is actually more helpful than fighting against it. There's a great saying, what we resist persists. And so this is really about allowing rather than resisting. Allowing the experience to be what it is and to give yourself permission for the full emotional experience of this. And to encourage the people around you to let you have it, rather than them saying, you gotta stay positive, you gotta get up, you can't stay here. You're not gonna stay there. But sometimes you need a little time in the puddle. And then just finding the things that inspire you. I just put some quotes together that I thought were helpful. Some days there won't be a song in your heart, sing anyway. One of my favorites, courage is not the absence of fear, but rather the judgment that something else is more important than fear. Courage requires fear. You can't have courage if you're not afraid. You have to be afraid to find your courage. Michael Douglas, cancer didn't bring me to my knees, it brought me to my feet. Stand up, that's what you're doing. Cancer's not for sissies. That's true. The human spirit is stronger than anything that can happen to it. Give yourself the credit you deserve. You're stronger than you give yourself credit for. And then my favorite, courage doesn't always roar. Sometimes courage is the quiet voice at the end of the day that says, I will try again tomorrow. That's it.
Thank you, Dr. Ginsberg. Please remember to text your questions. We ask you to frame your questions in a general manner so they can be helpful to as many people as possible. We will do our best to answer as many questions as we can. Dr. Ginsberg, thank you so much for sharing with us the different tools and strategies for our tool belt. We have Jonice and Shazine who are going to help us with our questions. And I'm going to kick it off with a couple of questions. I think when you discussed friends and family members who over time they tend to they just tend to leave, or they tend to disconnect. We had a couple of questions come in around that, and the first question is, do you confront those who abandon you, or do you let them go?
This is a common question, so it's a very good question, and the answer is not an easy one. I think about our relationships as an onion. So if you think about the layers of the onion, the little part in the middle of the onion, those are your primary people. That's your spouse, your children, the most primary people. And then your closest friends, and then your friends, and then your acquaintances, and so on. So in order to answer that question, I want the person to figure out where that person falls in the onion. So if the person is one of their closest friends in the inner layers of the onion, then it may be worth having the conversation because that person has been very important to them. If it's an outer layer of the onion, it's less important. And so it may not be worth the effort that it takes and the anxiety that it brings to have that confrontation. So the level of intimacy of that relationship is kind of how you determine whether or not it's worth the energy that it will take you.
I like that analogy with the onion, too. I'm going to kick it to Jonice or Shazine for any questions.
Okay. How does one move from denial to acceptance?
Great question. It is a process, and so you can't jump from denial to acceptance. You kind of have to work your way through it. And so if you think about many people are familiar with kind of the stages of grief, and denial is considered the first stage of grief. And acceptance is the last one, by the way. And so there's stuff in between. It's kind of a road to get to a place where you are accepting of what's been handed to you. And so working through it, through talking about it, through educating yourself, through understanding what's being asked of you. Coming to a conference like this, I think, is so, so helpful because, I listened to the earlier presentations, and that's complicated information, really complicated information. I have to say some of it went over my head, and I think probably some of it went over some of your heads, although I also know this is a very sophisticated group, and I'm always amazed at what people know. But beginning to incorporate that information and making yourself an educated consumer of the services that you're using is what will help you kind of move through that process. So denial is a normal first response. I can't believe this happened to me. I can't believe it. How is this even possible? Maybe it was a mistake. And so you have to let yourself kind of work through all of those different stages, and you do it by talking about it, processing it, educating yourself, seeking the support of others.
And I'm actually going to take it back to that onion analogy. I have a question, and it says, how do you deal with the fact that even after cancer, you are expected to continue as usual, kind of that innermost layer? Family and friends forget you have been through a catastrophic experience and just don't get it. Mm-hmm. And the second part is when I get bad news, I don't share it quickly because I'm expected to be the comforter. And so I'm assuming when this person wrote that, it's in relation to family and friends, which is that innermost layer of that onion.
Right, and so the innermost layer, that's the one always worth investing your time and energy in. We bring our life experiences and those relationships to this experience, to the cancer experience. And so let's talk about your spouse. The whole history of you and your spouse, or your caregiver, whoever that may be, the whole relational history comes to this experience. And let's face it, those relationships are never just simple, right? Those are complicated relationships that are fraught with the ups and the downs of what is normal in those relationships. And so we bring all of that baggage into this experience. And we think this should be simple because now I have this terrible thing and you should just be supporting me. But we can't deny that all of that baggage has come with us into this experience. So there is not a simple answer to managing that, clearly. This is where couples counseling, family counseling can be really, really helpful if a family is struggling with figuring out a way of talking about this and coming to terms with it. But I think letting people know what your needs are, asking your family to tell you what their needs are. What happens is this thing called protective buffering, where we start to not talk to each other because I'm protecting you because this is hard for you, and you're protecting me because this is hard for me, and so now we're just not going to talk about this anymore. And silence ensues. That ain't good. That's not good for a relationship. And so if you're finding that everybody has kind of gone to their separate corners, that should be an indication that some counseling is probably needed.
Thank you.
All right, we have a few questions coming in pertaining to mental health resources after diagnosis. What do you think about how cancer patients are not given mental health resources when they are diagnosed? And then I have a second part to that. Is it more beneficial to work with an oncology-specific therapist?
So I do think let me answer the second part first. I do think that if you can find somebody who is experienced and educated in working in oncology, that's certainly going to be helpful. There is a certain language and understanding of the process that I think is very, very useful. It's not easy to find, I will admit that. It's not the easiest thing in the world to find. But through organizations like Living Beyond Breast Cancer, like the Cancer Support Community, you may be, by getting in touch with those national organizations, they may have referral lists of people who have experience with oncology. So if you can find somebody with that experience, it certainly is preferred. As far as like the standard of care with mental health, what is standard is that there should be an assessment of how you're doing in terms of your mental health at the beginning of your treatment. And it should happen multiple times throughout. I know that it doesn't always, it should, but I know that it doesn't. Many of you may have filled out something called a, what the heck is it called? It's escaping me. It's a thermostat. It's a mental health little diagnostic tool to see like what your area a distress thermostat, what your areas of distress are, and if you reach a certain level, a referral should ensue. But again, I encourage you, there is not an oncologist in the world that does not have an understanding of the mental health challenges of this disease. So the understanding is there, but sometimes you just need to ask for it. And I think that a lot of people may be reluctant to ask for that kind of help. Don't be reluctant, because it's just the most common thing in the world to need this kind of help. And so let yourself ask the oncologist, the nurse navigator, the nurse practitioner, whoever is available to ask these questions, the social worker at the institution. They should have some resources available to you for referral. And there are lots of organizations where you can find it for free, or your insurance will cover it. And so it's out there, but it does take some legwork to find it.
Dr. Ginsberg, in one of your earlier comments, you brought up caregivers, and I can relate to this next question. My mother was diagnosed with metastatic breast cancer, and my father was diagnosed with prostate cancer when I was a teenager. This question is, what is your advice to younger caregivers providing care to their parents or relatives?
It's a big nut to crack when you are young to have to manage something like that. I want people to see it as kind of a team approach. We are dealing with this. We as a family, Team Jones is on this. And so with a team, people have different roles. And so if a family can sit down and figure out what those roles are, it's really, really useful, even for a young person. A young person is probably better than anybody at doing the technology stuff, right? Finding the resources, figuring out what's valid and what's, like, way better than people of my generation, and way faster too, by the way. So there can be, roles for each person, including the patients. What is your strength? What is your strength? What is your strength? How can we pull this together so that we're taking kind of a team approach to this?
And everybody feels like they're contributing.
Yes, and we're being honest with each other. We're saying, what our needs actually are.
I like that. Questions from the audience?
Yeah, that was really great. Quick follow-up question to that came through. Can you share some initiatives on the national level for helping children under 18 who are caregivers or dealing with a parent coping with the diagnosis of cancer?
There are, yes, so again, organizations such as the Cancer Support Community. Cancer Support Community is a national organization that provides free services to members of the whole family. And so I know in the Philadelphia area, I'm very involved with the Philadelphia affiliate of this organization. They have a very strong children's program. And so not every one of them have a children's program, but they're out there. So I know LBBC has resources available for patients to help talk to their children about it, books that they can help young children understand. So those things are, in fact, out there. Again, it's going to take some legwork, but you can find these things.
And I'll add to that, we have our Reading for Reassurance here at LBBC. We also, I believe there are 2 evidence-based nonprofits. The one you shared, I think there's also the Pickles Group and Wonders and Worries that provide support for the entire family. And so definitely providing education for the entire family is so important. Any questions?
I think we have a few more minutes.
Absolutely, yes,
Okay.
absolutely.
Generalizing this question a little bit, how to deal with a spouse or partner who is becoming overbearing.
That's a simple question, but that's a big question. The partner is going through something too. The caregiver clearly is going through something too. And so your partner, your spouse, is, it may feel like it's overbearing, but it's really their attempt to control probably the situation to the best of their ability. And that's difficult, because it may not be what you want or need, but it may be their way of managing. And so there is a great need for empathy on the part of both people in the couple, because it is really hard for both people. I have always said about caregivers, it is one of the most difficult things a person will ever do is to care for their spouse who has cancer. It is so difficult because that person really does need to set aside some of the things that they wanted and they hoped for and they aspired to, so that they can care for the person who also is dealing with letting go of the things that they hoped for and they aspired to in their lives. There is grief associated with this on both parts. And so I want people to come together in that grief rather than be at odds with each other in that grief. Because we can put up our dukes with each other about that, who's grieving more, right? And make it a competition about who's worse off here. Or we can join with each other in our shared grief about how this situation that is nobody's fault has changed our lives, and it's changed our dreams, and it's changed our hopes. that is very difficult. It's very sad. And so if it feels overbearing, and it may be overbearing, it really requires, that's the middle of the onion, it requires a sit down, it requires a conversation, a really honest talk about how can we move through this joined together as opposed to fighting each other on this. This is not about who has more control. This is really about, you know, us moving through the experience as a team, as a couple.
And I think that's why it's important. We just talked about children's resources. It's so important that there's resources that are there for caregivers as well, and that really focus on their needs as they're helping their loved ones. There is a question. As a person diagnosed before 40, I felt like I was just hitting my prime in my career. What tips do you have for dealing with grieving loss of a career?
Yeah, I mean, I think that it's a really hard one. You know, women are finally in a place where our careers are equally important as men's careers are, and we fought really hard to be in this place. And we've put a lot of effort to have careers that are meaningful and satisfactory, and so releasing that, whether it's releasing it partially or releasing it completely or not releasing it, these are very individual decisions. But again, this is about loss and about grief and about adapting to something that's thrown in your path. You know, and cancer isn't the only way that happens. I mean, lots of things can get thrown in your path that really throw off your trajectory, right? I mean, you could have been in a car accident and lost a leg. You could have, you know, anything could happen in a person's life. Another family member could have gotten sick instead of you. So things do happen in our lives that we don't have control over. And again, this is about accepting what is, adapting to, figuring out what's most important to us, what aligns with our values most, so that we are pursuing the things that are most meaningful to us, give us a sense of purpose, fill that space in a way where we still can get satisfaction. You may be able to use some of the skills that you've used in your career in a way that's different, that can be equally fulfilling or maybe even more fulfilling, and that kind of is some of the post-traumatic growth stuff that we talked about earlier.
Thank you. I think we have one more.
We often hear that metastatic breast cancer is an invisible disease. How do you handle conversations with people who say things like, you don't look sick, or you look great, despite your MBC diagnosis?
Mm-hmm. Yeah, it's it's one of those things that's very isolating, and it really emphasizes the fact that most people just don't understand what metastatic breast cancer is. And I want us to be grateful for that in one way, because, you know, we don't want everybody having the experience of having a loved one with metastatic breast cancer. It is still the minority. But on the other hand, it means that people don't get it, you know, and you are always going to run into people who don't get it, who don't understand. And again, that question of, are you done with treatment yet? Are you finished now? You went through that thing and you're done now? I mean, there is just a general misunderstanding. You have to decide, based on your values, if you are this is one of the scripts, right? So are you going to correct people and let them know, no, I'm still in treatment, I'm going to be in treatment for the rest of my life? Or are you going to let that go? You know, you decide. There's no right answer. You have to just decide what's right for you. What's right for you based on your personality. And again, you might have different scripts based on where people fall in the layers of the onion. The people on the outside, you may decide that they just, you know, thank you very much. Yeah, I feel good. You know, that's it, and you move on with your grocery cart. But for people who you're closer to, you want them to understand. You want them to get it. And so you may need to kind of come up with that script about what this actually is, and that it hurts your feelings when people don't understand.
So acknowledging that it hurts my feelings.
Yes.
Wow, thank you so much, Dr. Ginsberg.